Can you hear me?
Yes, we can hear you.
Respected organizer, Dr. Sanjay Bedi, and the facilitators of CBME group, Dr. Pragna ma'am, Dr. Sucheta, Dr. Nibrati, Dr. Rohini, and my dear senior and junior colleagues. Very good evening to you all. September 1st week is observed as a National Nutrition Week to create awareness about right nutrition for overall health. Prime Minister Modi, Mann Ki Baat session, said that the month of December will be observed as Poshan Ma, or otherwise called as Nutrition Month. He threw light on Yatha Anam Tatha Man, which means mental and intellectual health development is dependent on the kind of food we consume. With that note, I, Dr. Sukanya Shetty, Professor of Biochemistry at KS Hegde Medical Academy, Mangaluru, welcome you all for today's nutrition competence presentation. I have the privilege of introducing my team, Dr. Pragna Rao, facilitator, former Professor of Biochemistry at KMC Mangalore, and former Dean of KMC Manipal, and former head of the Unit of Medical Education Unit, Manipal. Dr. Sridevi, Professor of Biochemistry at the Subbaiah Medical College, Shivamogga. Dr. Shubha Rao, Associate Professor at St. John's Medical College, Bangalore. Dr. Sindhu, Associate Professor at KMC, Mangaluru. Dr. Sonal Kani, Associate Professor, Pacific Institute of Medical Sciences, Udaipur, Rajasthan. Dr. Sonali, Assistant Professor, ABV, TMC, Vidisha, Madhya Pradesh. Dr. Major Sandeep K. Yadav, Assistant Professor, Sabrati Medical College, Meerut. Dr. Major Sham, Associate Professor at GMC, Anandpur, Andhra Pradesh. Dr. Sindhu, Dr. Sonali, and Dr. Sham are unable to present for the webinar today because of some other commitments. The objectives of this presentation would be SLO's Framework Competencies 8.1 to 8.5, Teaching Learning Methods, Allotted Hours and Assessment Methods, SDL and Research Options bar electives, Early Clinical Exposure and Sample OSPE questions, Sample questions for assessment which include long essay, short essay and short answers, and MCQs, Integration modules, and something unique we are going to present Nutrition Ward in Anandpur GMCH, Andhra Pradesh, how this can be merged with the teaching undergraduate students, and finally summary. Moving on to the competencies. Competency for BI 8.1 and BI 8.5. Competency BI 8.1 discuss the importance of various dietary components and explain importance of dietary fiber. BI 8.5 summarize the nutritional importance of commonly used items of food, including fruits and vegetables. That is macromolecular importance. The two competencies we have merged because when we were working for the SLOs, framing the SLOs, majority of the SLOs are similar in BI 8.1 and BI 8.5. SLOs for BI 8.1 and BI 8.5. The phase 1 MBBS student shall be able to identify key macronutrients of diet, define caloric value of food, and list the caloric value of carbohydrate, proteins, and fat. Define respiratory quotient and list the RQ of carbohydrate, fat, proteins, and diet and mixed diet. Define basal metabolic rate, list the factors affecting BMR, different types of measurements of BMR, normal value of BMR. Define specific dynamic action. Enumerate the specific dynamic action for carbohydrates, proteins, fats, and mixed diet. List the different types of physical activity. Discuss the energy requirement of different physical activity. Explain the steps for calculation of energy requirement for different physical activity. Discuss the major dietary carbohydrates with their clinical significance. Describe glycemic index with reference meal as 50 gram of glucose and list the glycemic index of common food. Define dietary fiber and their requirement per day. Explain clinical importance of dietary fibers with examples. List the sources, different types of dietary fat, recommended daily intake and nutritional importance of lipids. List the different sources of dietary cholesterol and its clinical importance. Discuss the importance of essential fatty acids, PUFA and trans fat with suitable examples. List the sources, recommended daily intake of dietary protein and their nutritional importance. Define nitrogen balance, enumerate their types. Enumerate the factors affecting nitrogen balance and maintenance of nitrogen balance. List the indices used to assess the nutritional value of protein and add a note on amino acid score. Discuss about the essential, limiting amino acid and mutual supplementation of proteins. List the common food items of Indian population and their ratio in diet. Discuss the nutritional value of cereals, pulses as major food items in Indian population. Discuss the relevance or importance of mutual supplementation of cereals and pulses. Explain why milk is a complete protein. Explain why egg is a reference protein. Discuss the nutritional importance of fruits and vegetables. Discuss the role of water as an essential nutrient of life. Now the competency BI 8.2. Describe the types and causes of protein energy malnutrition and its effects. SLOs for BI 8.2. At the end of teaching learning session, the phase 1 MBBS student shall be able to classify protein energy malnutrition, enumerate the causes for protein energy malnutrition, discuss the etiology and biochemical basis for manifestations observed in Kwashiorkor and marasmus, differentiate between Kwashiorkor and marasmus with respect to clinical features, laboratory findings and management, define and list the causes of cachexia due to diseases. Now, I request Dr. Shubha Prakash to continue. Thank you.
Thank you, Dr. Sukanya. Competency BI 8.3. Provide dietary advice for optimal health in childhood and adults and in disease conditions like diabetes mellitus, coronary artery disease, and in pregnancy. SLOs for BI 8.3. At the end of the teaching learning session, the phase 1 MBBS students shall be able to name 3 methods for assessment of nutritional quality of proteins, define a balanced diet and enumerate the dietary proximate principles and their importance, discuss the general principles of prescribing a diet based on calorie requirement, proximate principles, general composition of food, and determine the items of food. Plan a balanced diet with sufficient calories for healthy adult and child, considering age, sex, body weight, physical activity, food habits, local availability of food items, and socioeconomic status. Describe the different steps of prescribing the diet for patient with respect to glycemic index and add a note on dietary guidelines to be followed by the diabetic patient. Describe the different steps of prescribing the diet for coronary artery disease patient, considering age, body weight, food habits, local availability of food items, socioeconomic status, treatment history, etc. Describe the different steps of prescribing the diet with sufficient calories for a pregnant lady. Possible references if we are not able to get it in textbooks. Diet and diabetes available on the NIN National Institute of Nutrition website 2020. Article published in Diabetes Care by Madeline et al. In 2012. Dietary Guidelines for Indians, second edition by NIN Hyderabad 2011 issue, and Nutritive Value of Indian Foods by NIN Hyderabad. Competency BI 8.4. Describe the causes, including dietary habits, effects, and health risks associated with being overweight or obese. At the end of the teaching learning session, the phase 1 MBBS students shall be able to define obesity and classify obesity based on BMI and body fat distribution, list the causes for overweight and obesity, including genetic cause for obesity, discuss about physiological regulators of appetite, enumerate the health consequences of obesity in adults and children, identify the psychological causes for weight disturbances, enumerate the comorbidities associated with overweight and obesity, that is diabetes mellitus, obstructive sleep apnea, metabolic syndrome, discuss the role of diet and exercise in weight loss, non-surgical or medical management of obesity, low-calorie diet, reduction in portion size, changes in frequency of eating, changing macronutrient composition. Coming to the teaching hours, teaching learning methods, assessment methods, and integration for the competencies that we have just discussed. For BI 8.1 and 8.5, estimated teaching hours is 3 hours for 8.1 and 2 hours for 8.5. Lectures and small group discussions, assessment methods by SAQ, MCQ, Viva, integration with general medicine IM 23.1, pediatrics PE 9.1 and 9.3, community medicine CM 5.1. For BI 8.2, estimated teaching hours is 1 hour. Teaching learning methods, lecture or clinical case discussion. Assessment methods can include SAQ, MCQs, Viva, and clinical case chart discussions. Integration with pediatrics, PE 10.1 and 10.2, general medicine IM 23.2, pathology 12.2. For BI 8.3, estimated teaching hours is 2. Integrated lectures or small group discussions can be used. Assessment methods can include long answer questions, SAQs, MCQs, seminars, OSPE, or a question to prepare a diet plan. Integration with general medicine IM 23.1. BI 8.4 estimated teaching hours is 2. Teaching learning methods, it can be a small group discussion. Assessment methods can include SAQs, MCQs, case-based response type or stations. Integration with general medicine IM 14.1 and 14.4. I now request Dr. Sonal Sogani to continue with self-directed learning.
Thank you, Shobha ma'am. Am I audible?
Yes, yes.
Hello. Okay. Now today
Yes, you are
audible. I'm going to present self-directed learning. So the task given to the students will be calculate the BMI for yourself and 2 of your family members, tabulate your finding and what dietary advice will you give to them. Specific learning objectives will be at the end of the SDL session, phase 1 MBBS students shall be able to calculate the BMI and classify as underweight, normal or overweight, obese. Calculate the calories required for their ideal BMI. Plan a balanced diet for maintaining their ideal BMI. Time allotted will be 1 week time for collecting or gathering data, and time allotted for discussion will be for 2 hours. Next slide, ma'am. Now, planning of SDL for students can be announcement should be done 1 week prior to the date, task, and SLOs will be given to them. Study materials can be provided such as reference books, YouTube links, They can be asked to prepare a diet chart or a diet plan. Then 150 students, they are divided into 6 teams, and each team will be having 25 students and 1 facilitators for each team. Assessments will be done at the end of the session and with the help of the e-posters. Next slide, ma'am. Okay, I'm going to hand over to Dr. Sonali Mishra. Ma'am.
Sonal, you continue.
Hello. Okay, ma'am. So the projects given will be ICMR funded STS projects, short-term studentship program to encourage and support MBBS or a BDS students in research, project accepted on nutrition like correlation of BMI and lipid profile analysis by medical undergraduates. Second will be NIM projects, that is nutrition in medicine, nutrition education for medical students and residents. NIM is strengthening medical nutrition by providing free comprehensive online nutrition curriculum with clinically relevant evidence-based medical education for UG and PG learners. Next slide, ma'am. I'm going to hand over it to Dr. Sridevi, ma'am. Okay, now continuing, that is early clinical exposure, a diet counseling for patient with diabetic foot. Early clinical exposure, so setting will be classroom or a case-based scenario can be given to students. Topic will be diet counseling in diabetes with competency BI 8.3. Specific learning objectives will be at the end of the ECE session, phase 1 MBBS students will be able to explain the nutritional importance of dietary carbohydrates and fiber, plan a diet for the diabetic patient taking into account locally available food items, counsel the patient regarding lifestyle modification. The learning experience, total time will be 3 hours. Introduction to the topic, group discussion with the peers, group division and instruction to students. So the time will be 20 minutes. Exposure to clinical case scenario and discussion. Total time will be 90 minutes. Summary and conclusion 10 minutes. Assignments 30 minutes and reflection will be for 30 minutes. So total 3 hours timing. Next slide. A clinical case scenario will be a diabetic farmer with swelling and wound with foul smelling discharge on his right foot approached the village Ayurvedic doctor who advised him to apply some herbal medicine. A week later, the farmer noticed that the wound had not healed. He therefore decided to visit the hospital in the city. The doctor examined him and directed him to get some blood investigations done. His fasting plasma glucose was 280 milligrams per deciliter and postprandial plasma glucose was 325 milligram per deciliter. HbA1c was 10.5%. His diet history shows 4 cups of rice for breakfast and 4 pieces of boiled tapioca along with fish curry comprising of 2 pieces of mackerel for lunch. For dinner, he had 2 rotis and a cup of dal. His dietary history revealed that he hardly consumes vegetables. Discussion on questions will be define glycemic index, list the glycemic index of common foods, plan a diet for the diabetic patient taking into account locally available food items, calculate the total caloric content of his diet, counseling the patient regarding lifestyle modification. Assessments for the students can be MCQs, short answer questions, long answer questions at the end of the session, e-posters, mock counseling with stimulated patient or volunteers. HOSPI. The next slide, ma'am. Name the food component that forms the apex of this pyramid. Mention the calorific value of this component. Each questions will be having a 1 mark each. Name the limiting amino acid in this food item. Give an example for mutual supplementation of proteins. Each question carries 1 mark each. Identify the misnomer. State the BMR for a healthy adult male. Again, the questions, each question will be of 1 mark each. A 42-year-old female presented with complaints of breathlessness, giddiness, and palpitation. On examination, she was obese with BMI of 32. BP was 160 by 100 Hg millimeter. Serum triglycerides 350 milligrams per deciliter. Plasma insulin was 50 MIU per liter. Urinary microalbumin excretion was 300 milligrams per day. What is your probable diagnosis? That carries 1 mark. What are the causative factors? Again, the question carries 1 mark. What advice will be given to patient? 2 marks. That is overall 4 marks. Sample question paper. So then I'm going to hand over it to Dr. Shubha ma'am.
Thank you, Sonal. A few sample questions. For long essay, a 12-month-old boy is brought to the pediatric OPD. The young malnourished mother complained that her child falls sick on and off with constant rhinorrhea and cough. He has become skinny. Diet history reveals that he is fed with diluted milk and occasionally mashed rice, occasionally with mashed rice. What is the probable diagnosis? Justify your diagnosis. Discuss the importance of food pyramid. Advise balanced diet for the above child for 10 marks. Another example for long essay, define body mass index. Describe the laboratory and bedside methods of testing body mass index. List and explain the factors affecting body mass index for 15 marks. Short answer questions for 5 marks. Enumerate the types, symptoms and signs of protein energy malnutrition. Describe the importance of specific dynamic action and respiratory quotient in planning a diet. Discuss the clinical importance of dietary fibers with suitable examples. Calculate the calorie requirements for 65 kg man who does heavy work. Sample questions for MCQs. A fast food restaurant utilizes edible products that achieve the bliss point of texture along with desirable taste. These products are designed to have longer shelf life. Which of the following substances in these products is most likely to increase atherogenesis? Another MCQ. A 4-year-old child was born at term with no congenital anomalies. She is now only 70% of normal body weight. On examination, she shows dependent edema of the lower extremities as well as an enlarged abdomen with palpable fluid weight. Her desquamating skin shows irregular areas of pigmentation and hyperpigmentation. Which of the following nutritional problems is most likely present in this child? For our topic, there are 2 competencies which comes even under practicals, but they fall into the knows and knows how category. These competencies have they have been discussed along with the competency 8.1, so that is why we are not presenting the SLOs again for this practical competency. I now hand over to Dr. Major Sandeep Kumar Yadav for integration.
Thank you, ma'am. Am I audible?
Yes, you're audible.
Good evening to all of you. I am going to present the sample integration module for the nutrition competencies. So topic is advised diet for healthy pregnant women considering body weight, food habits, local availability of food items and socio-economic status. So for competency BI 8.3, it is plan balanced diet for healthy pregnant considering body weight, food habits, local availability of food items and socioeconomic status. So it can be integrated with ops and gynae competency, which is OBG 8.6. It says that assess and counsel a patient in a simulated environment regarding appropriate nutrition in pregnancy. So for these pregnancies, for these competencies, we have learning objectives. So at the end of session, the phase 1 student shall be able to interpret the increasing demand of nutrients in pregnancy, discuss the possible nutritional deficiency in case, and to advise the suitable diet plan in pregnancy. So setup is for antenatal clinic or in classroom, and case is as a 28-year-old lady laborer in her second trimester of pregnancy visited booked ANC clinic with her 2-year-old first child. She complained of tiredness, shortness of breath on slight exertion, episodes of lightheadedness and cramps in her legs. On examination, her pulse rate was 90 per minute, face and nail beds were pale, and she has sunken eyes. Her blood report reveals as hemoglobin of 7 gram per deciliter, RBC count as 3.5 million per mm of cube, and hematocrit as 30%. Serum iron was low, and total iron binding capacity was high. So task is to identify the nutritional deficiency in this case and to advise her a suitable diet. So now I would like to invite Dr. Major Shyam Prasad for presenting these unique slides. Sir, are you there?
Okay, yeah. Thank you, Major Yadav. A big hi to all again. After learning all through teaching and hands-on training and simulators, still there is something which will lag a student from having a real-life experience. We were fortunate enough that we have a center called Nutritional Rehabilitation Center in our GMC GGH complex, which looks after undernutrition patients, especially the pediatric age group. Next slide, please. As malnutrition is mostly seen in underprivileged migrant laborers and local laborers which cannot afford, so the government of our Andhra Pradesh decided to have a 20-bedded facility in each medical college institution, and it was started as a pilot project in our medical college. So this facility is actually meant to admit cases who are not affordable or who cannot plan a diet, because whenever we try to treat a patient on outpatient basis, the language what we use in the nutritional headings as so and so items, they will never be able to procure with their own funds, or they will never be able to cook in the manner that is decided to cook. So government decided that they'll admit them in the hospital and treat them till they recover completely from the nutritional disorder. So it is basically a 20-bedded ward which is colorful and painted with full images for especially for children. It is staffed with doctors from 3 departments: pediatrics, medicine, and biochemistry. Again, some nutritionists are there, nurses round the clock, and some counselors who can speak to them in their local language and explain them the circumstances. So the basic motto of this rehabilitation center is evaluate and advise and manage nutritional disorders. The management in this center varies from outpatient to inpatient. Next slide, please. So, as most cases are from poverty-ridden families, a special diet based on the deficiencies are identified and specially prepared for the child and mother, and it is served in the right time, in the right proportions throughout the day. Even if it is 1 month or 2 months, it doesn't matter for the setup for them. They will continue the diet again. So cases at rural levels are identified by health volunteers who are stationed in their villages, who are nominated by the government. They are basically responsible for preventing any death due to undernutrition thing. So they will identify the cases and bring them here to the center. Once the case is discharged from this center, again there will be a continuous follow-up to prevent recurrence of the undernutrition problems. So generally, this is a facility which was started around 2 years back in our setup. So as CBME was implemented this year, we had a time and privilege to force the student to have a hands-on experience. Initially, we were a bit hesitant to try the students on that, but after the successful implementation of one trial, we were very happy that the students were also getting something out of it. So students were divided in groups and allotted some specific cases in them because most of the cases are generally related to protein malnutrition. So each student and their group were asked to follow up a case from admission to discharge so that they can identify the progress and also identify the nutrition what is being supplemented to him to prevent the disease or avoid the complication in that. So as the regular schedule is busy with all the classes and all the curriculums, they were asked to go after the college working hours, spend some around 15 to 20 minutes daily on a periodical basis or regularly as is convenient to them and maintain a case record and submit back to the department. So only allotment and familiarization of how to take a diet history and how to manage a case was given in the ECE. Remaining things were taught on as on need basis. So in this exercise, finally, teaching again will make them a good practitioners. So we encourage the students to give them some demonstrations to the patient on laptops and speaking to them. So even that was tested in this lab in this way. So they spoke very well, and the patients also were very happy, and the students basically they became very happy because they were able to convey what they wanted to convey, and they had a hands-on experience on seeing the patients, understand them, and realize what is its importance. So this was the first-hand experience for the first batch of CBME students which we tried in this nutrition classes. So this is one slide which shows a few cases which were where the photographs were taken prior to admission and at the time of discharge. There was a definite improvement. These photos were actually taken by one of our students regarding their patient. They submitted it back to the department to show that this was the progress on the day of admission when they went to the patient and the day of discharge when they were going out. So this gave a happy smile to all the students also because they were able to follow up on real hands basis. Thank you for the opportunity. I now request Dr. Pragnarao ma'am to continue.
Thank you very much. So first of all, I'd like to really thank my group, the CBME Group 8, for a wonderful, wonderful presentation and all the hard work. Let me very quickly tell you that all these ideas have come from them. Each and every idea has come from them. And we are really, really sorry not to have with us Dr. Sindhu, Dr. Sonali, and Dr. Sridevi. Dr. Sridevi had tech issues. She was supposed to present, but she couldn't. But her contribution was immense, as was Dr. Sindhu's and Dr. Sonali. So a very, very big thank you, and we missed you during this presentation. A few things are a little different in this group's presentation. The first thing is the references to the NIN documents. What we have seen is most of the time textbooks treat nutrition a bit too lightly. And if you look at the students' answer papers or Viva questions, it's like eat green leafy vegetables and eat healthy, good food, and it's a wonder that they don't say eat oysters and all kinds of foreign names which the poor patient has never heard of or seen. And it is with that in mind that this group actively looked for references, keeping in mind socioeconomic factors as well as local changes, and therefore recommended the NIN references. So that was one unique thing. The second unique thing was Dr. Sonal, I think, felt that here was an opportunity for students to write ICMR STS projects on nutrition, because that is something which even the government of India pays a lot of importance. As you can see, the entire month of September, coincidentally, has been earmarked as the nutrition month. And not only that, going ahead, when the electives come up, nutrition and biochemistry, when they have to do an elective in basic sciences, nutrition can be one very important elective which can be given to students in the future. So here is a group of faculty which is even looking beyond just biochemistry and looking at this topic for multiple uses. And the third very, very important find, I will label it as find, is Dr. Shyam. We literally found him. He is a very quiet, unassuming person. and had to be pulled literally because he had a lot of administrative duties as well. But Dr. Shyam's unique presentation on the nutrition ward and the fact that they have used it successfully on the first MBBS students for ECE is a shining example of how we can make use of basic sciences at a clinical setting and as biochemists be very, very active in the clinical mode as well. So a special thank again to Dr. Shyam, but a thank you to everyone in the group. I'd also like to take this opportunity to thank Dr. Sukanya, who really started the whole thing. She did she was the one who chabi marod, as to say, and initiated the proceedings, but it was fantastically done. So thank you, group, and we will now take questions. Questions will be answered by the person who has presented that topic to the group. So over to you for questions. Any questions? We are not able to hear. There is spotters because we were not testing psychomotor skills during OSPE. So I agree to that, because when there is no psychomotor skill which is being tested, then it is more correct to call it as spotters rather than OSPE. Any other questions? Dr. Sanjay, are you seeing any questions in the chat box or any hands?
Excuse me, ma'am.
Dr. Rohini and Dr. Sucheta are asking to be unmuted. Who's I can hear somebody coming out with a question. Any questions? Dr. Sucheta and Dr. Rohini, type your question in the group and I will read it out, because you are not unmuted.
Ma'am, I have unmuted Dr. Sucheta.
Okay.
No, I just wanted to make a general comment. This idea of the OSPE is good, except for this topic, where I think we cannot really use it for any psychomotor skills. But to take this idea forward, I think we should be thinking about the whole curriculum in general, and trying to see which are the topics which we could maybe use to be converted into OSPE stations.
At a very distant point, with the coming in of POCT instruments, something like how to use a glucometer would definitely help in a OSPE station. But we have to also be frank and say, okay, we don't have any psychomotor skills in biochemistry, so let's convert everything into spotters. And I think that would be okay, There are very, very few. I mean, we are not going to look at how well they pipette or something like that. So I think it's fine.
Correct. No, or even, a simple qualitative test that we could do, hey, sulfur flour or something like that.
Yeah.
They could have,
actually, I was very much, but I remember talking to you about this, and then you said it's coming in 11 competency number 11 about, how do you collect sample and how do you look at a vacutainer, or we could introduce that. It's not difficult to do that.
Correct. The which top tube, red top tube you will use
Yes,
where.
absolutely.
Some small things like that we could introduce.
Yeah.
But OSPI cannot be used as a full-fledged exam, assessment tool.
No, not possible. Agreed.
Yeah. Thank you. Well done, everyone.
Thank
I
you.
think Rohini also wants to say something. There was someone else who wanted to talk.
Rohini is unmuted.
Someone else who wanted to say something.
If they are not unmuted, please type your question in the group and I will read it out.
And there is one attending the name of Dr. Sridevi only, but they are self-muted now. They have raised hand. They can unmute themselves and ask question.
Okay.
Can't say. Ma'am, no more hands are there.
Okay. So Sujata, if no more hands are there, can we call it an early night?
Night, yes. So we can all go have an early dinner. So
Yes.
congratulations, well done, everyone. And since the topic also was nutrition, I think we do deserve a good meal now.
Done.
So with that, thank you so much. Yeah. Bye-bye. Good night.
Thank you.
And
Pragna ma'am.
one more thing, just to clarify any doubts. Monday, group 9 will present. In some people's timetable, apparently it looked blank or something, but it is not blank. We will go on for, even if it is some oversight or whatever, we will continue. So group 9 will present on Monday.
Okay, that's good to know.
Yeah. All right. Bye-bye. Good night.
Yeah, thank you.
Good night.
Thank you, everyone. Thank you, Pragna ma'am.
Very nice presentation.
Thank you, everyone.
Okay, thank you all. Thanks, everyone.